Cardiovascular disease in Los Angeles. Cardiovascular disease, also known as heart disease, is a chronic illness that remains the leading cause of death in the world, including in the United States. Every year, over 600,000 people die due to heart disease or problems with the heart. It is the leading cause of death in both men and women around the world. Heart disease is caused by a buildup of fat and cholesterol in the arteries, which are tubes in the heart. This buildup, also known as plaque, causes less blood to flow through. This increases chances of heart attack, stroke, and other dangerous health issues. Every 40 seconds, someone in the United States has a heart attack. In this picture, it shows what is happening in the heart that causes a heart attack. Fat and cholesterol starts to build up in the arteries or tubes of the heart that is called plaque, as shown in the right of this picture. This plaque continues to grow over time, and if not treated, it eventually stops the flow of blood through the heart, causing a blood clot. This, in turn, causes a heart attack in which blood flow is stopped in the heart. In Los Angeles, heart disease is the top cause of death in people aged 40 and older in both men and women. Over 12,000 people aged 40 and older living in Los Angeles County die every year due to problems of the heart. In general, every 215 people of 100,000 people die from heart disease. Per California's Department of Public Health, Los Angeles was ranked among the worst of California's counties in deaths caused by heart disease. Heart disease costs the United States $200 billion every year. This includes medication, treatment, hospitalizations, aftercare, and other costs associated to the disease. This map is from the Center of Disease Control and Prevention. This map depicts death rate by heart disease in California in individuals aged 40 and older from the year 2015. The black circle is Los Angeles. It shows that over 300 people of every 100,000 people died due to heart disease in 2015. This map also shows other cities in California that are greatly affected by heart disease. Heart disease is the top cause of death around the world, but it is also the most preventable. About 90% of heart problems can be prevented by improving risk factors. Almost half of Americans, which is about 49%, have at least one risk factor linked to heart disease. In Los Angeles, people aged 40 and older have increased risk factors of heart problems. This target population has the highest death rate from heart disease in LA County and should be educated on heart health awareness. To target this group and improve heart health, we need to first lower risk factors, which will in turn reduce heart disease and ultimately reduce death caused by heart problems. Risk factors that cause heart disease include the following: diabetes, obesity or being overweight, lack of exercise or physical activity, poor diet, smoking and alcohol, high blood pressure, high cholesterol, no medical follow-up or care, family history, age, and lifestyle. To help reduce risk factors, here are the different ways to help fight heart disease and improve heart health. First, blood test. Routine blood tests will help make sure your cholesterol and sugar levels are under control to prevent heart disease. Exercise and weight. Being overweight is a big cause of heart problems. Exercising for about 30 minutes or more, 2 to 3 times a week, will help keep you fit and maintain a healthy body weight. Healthy diet. Eating healthy and nutritious foods that are low in fat and salt help make sure you are getting a heart-healthy diet. Smoking and alcohol. Smoking and alcohol increases the chances of heart issues. Make an effort to stop smoking and moderate alcohol consumption. Blood pressure. A healthy blood pressure is considered 120/80. It is important to keep a log of your blood pressures to make sure it does not go over normal, as this is a big risk factor to heart disease. Checkups. Routine checkups with your doctor will help make sure you and your heart are healthy. Lifestyle. Increased stress can lead to heart problems. Take time every day to walk, meditate, or do activities you enjoy to help control your stress, anger, and anxiety. Age and family history. Sometimes heart disease cannot be prevented, as it can run in one's family and be passed down. If this is the case, it is important to be extra cautious of reducing risk factors and taking care of yourself. Here is a summary infographic of the top heart disease risk factors and how to reduce them. High blood pressure. Make control your goal. High cholesterol. Work with your doctor on a treatment plan to manage your cholesterol. Diabetes. Work with your doctor on a treatment plan to manage your diabetes. Tobacco use. If you don't smoke, don't start. If you do smoke, get help to quit. Unhealthy diet. Eat a healthy diet low in sodium and trans fats and high in fresh fruits and vegetables. Physical inactivity. The Surgeon General recommends adults engage in moderate intensity exercise for 2 hours and 30 minutes every week. Obesity. Work on maintaining a healthy weight. In conclusion, cardiovascular disease is the leading cause of death in both men and women around the world. In the United States, over 500,000 people die from heart problems every year. Specifically, in Los Angeles County, heart disease is the top cause of death in people aged 40 and older. However, heart disease can be prevented. To prevent heart disease, we first must reduce risk factors. This can be done by having a healthy diet, increasing exercise, controlling blood pressure, diabetes, and cholesterol, stopping smoking and drinking alcohol, having routine medical follow-up with a doctor, and decreasing stress. By reducing these risk factors, we can reduce diagnosis of heart disease and ultimately reduce death by heart disease and heart problems. This will in turn reduce cardiovascular disease and mortality by cardiac events in Los Angeles in individuals aged 40 and older. By improving risk factors, we can improve heart health. Thank you.